Hello and welcome to this session, Understanding Functional Difficulties and the Impact upon Daily Activities. This session is hosted by the Children's Occupational Therapy Service at South Warwickshire University NHS Foundation Trust. You have been invited to this session because your child's referral highlighted functional difficulties. The aim of this session is to provide you with a toolbox of activities that you can implement into your child's daily routine. Research shows that strategies which are implemented throughout the day are most effective, and therefore, as parents or carers, you are the best people to implement this. We will cover what is occupational therapy or OT, how can occupational therapy help, why is your child having difficulties, and what happens next. The role of the Community Children's Occupational Therapy Service is to support children who encounter physical barriers to their participation in everyday living tasks. Children's occupational therapists help babies, infants, children and young people to grow, learn and play so that they can develop and reach their full potential. Occupational therapy focuses on the skills and abilities of the child and how they interact with their environment to participate in everyday activities such as washing, dressing, teeth brushing, cutlery use and self-feeding. These are also known as occupations. A child's work involves accessing education through attendance at nursery or school, or it could simply be about improving their ability to play with friends, participate in sport, or take part in community activities. Think about these pictures and the activities that children take part in every day. These are what we refer to as activities of daily living. Occupational therapy can help when children struggle to participate in these tasks. There are further presentations available on activities of daily living, fine motor skill development, and handwriting readiness. Occupational therapy can help by offering advice and strategies for you to implement to help your child develop their skills in these tasks. This will be discussed in more detail throughout the presentations. There are lots of reasons why children might have difficulties with their fine motor skills. Physical factors such as include problems with motor coordination, physical disabilities, developmental delay, joint laxity and reduced hand strength. Learning difficulties such as developmental delay, autism and delays in speech and language can also impact on skill development. Sensory impairments such as visual or hearing problems rather than sensory processing difficulties can also affect how children participate in learning. Behavioural difficulties with attention and motivation can also have an impact at home and in the classroom, which can be a barrier to learning and demonstrating fine motor skills. Another influence is children having the opportunity to experience things like messy play, construction toys, painting, which help to develop fine motor skills. The increase of technology within society is also impacting on these hands-on opportunities for children. Also, parental expectations and engagement are known to have an influence on how a child develops their skills. Stage, not age. Some children may take longer to develop their functional skills because of additional physical or learning needs. It is important to consider your child's developmental stage rather than their chronological age. A consistent 24/7 approach with the home and school offers more continuity and opportunity for a child to develop their skills. Every child follows a different path. Allow extra time and lots of practice. All children develop in their own time with support from family and educational setting. Most children will improve their daily skills with opportunity, practice and time. Remember, you can adapt the activity yourself and that there are lots of useful pieces of equipment and resources out there. You can access the South Warwickshire NHS Foundation Trust Children's Occupational Therapy website. On our website, you will find lots of further information, advice and videos on fine motor skills activities. We anticipate that for most children, these presentations will provide you with the tools and activities to support your child, and therefore your referral into Children's OT will now be closed. We recommend that these activities are trialled for a minimum of 12 weeks to embed them into your child's daily routine. However, if after 12 weeks of inputting the strategies you are experiencing significant difficulties, please either email us or give us a call. You will be provided with a telephone appointment where a member of the OT team will contact you. Please note that to enable us to assist you, we will require information on which activities you have trialled, when and for how long. You may find it useful to keep a diary of the strategies. Thank you for accessing the session. We hope you found it useful.